the only one. All right, starting your timer, and here is your question. Right, so if you have read and understood, considering its communication skills session, please begin.
Hello, Mrs. Jen. I'm Dr. Ahmed Abdo, one of the surgical doctor here. How are you, Mrs. Jen?
I am fine, but my husband is not fine at all.
I'm sorry to hear this, Mrs. Jen. I see that you are really upset. I'm here to tell you that unfortunately, Mr. Mann is called for an emergency, and he is unable to meet you today. So I'm here to help you and see anything you want and offer you any help.
So, Mr. Mann, I need to see him because he is a consultant of my husband. My husband's condition is deteriorating. 6 weeks now, he has diagnosis with a tummy, with something going in his tummy, has tummy distension, and even this is closing his lungs. So I need to talk to the consultant to go through the my husband condition. I need to talk to Mr. Mann.
I'm sorry, Mrs. Jane. As I told you, Mr. Mann is called for an emergency, and after he finish, I will inform him that you have been here, and of course, I will arrange you a new appointment with him to see the news of your husband and the management plan and everything you want. But unfortunately, the CT scan we are waiting for, it can't be done today because the machine is off service, and it will be fixed in 1 week time frame. I'm sorry to see that, to say that, but it's unexpected, and I'm sorry for this.
So you have only one CT in your hospital. It's really a very tiny hospital. And my husband's condition can wait another week. He now suffering for at least 6 weeks. Through that, we did go for any surgery. So I need to do the algorithm to treat my husband. We can wait for another week in this hospital. You are killing him.
I apologize for you again, Mrs. Jane. I'm very sorry. I know that you are in a tough situation, and you are suffering with your husband for a long time. Yes, we we are in a small hospital, maybe, but we have all of the investigation that we can provide for your husband to get a full picture for his disease. And all of this can be done in 2 weeks time frame. I promise you for this. But about the city, if we saw that your husband is can't wait or is suffering more, we can transfer him for another hospital to make the city as soon as possible. But for now, we have another alternatives and temporary alternative. We can go for this until the city is get on the service again.
Yes,
Don't worry.
please go for these alternatives, please.
Yes, we have ultrasound. If you don't know the ultrasound, it's like the jelly scan for the pregnant lady. It can show us the liver and if any suspicious spot in it, and also we can see by the ultrasound the amount of the fluid in your husband's tummy. But it will get us a little benefit because it will see out the fluid and the liver, and we need to see all of the organs inside the tummy to define exactly where the tumor cells come from, the cancer cells come from. Also, we have the MRI scan, but I'm afraid that we can't go for this scan without permission from Mr. Mann. So I will discuss with him after he will be free to arrange for MRI scan. If he agreed, we will go for this. And
So my
the last,
husband has
yes.
malignancy in his tummy. You saying that?
It's too early to say that, but only in our hand is the analysis of the fluid the fluid we are withdrawn lastly, and after analysis of this fluid sample, we find some cancer cells, but we cannot we cannot say that. It's too early to say that until we know where did this cancer cell come from and what is the degree, what is the grade of this, and also we have to we have to make a full management of the plan, and all of this information we have not till now. So it's too early to say that.
So for this cancer, you will prepare my husband for surgery for sure. I am right?
Surgery is for cancer patient if it only done when we are 100% sure that the patient will get a full benefit from it. And if in cases like advanced cancer, if the patient will not get a full benefit from the surgery, we are not going to put him in pain and the stress of surgery with a no benefit. So the surgery we will make if we are sure that your husband will get full benefit of it, and we cannot detect this now until we complete our investigations.
So you will keep him just no CT, no surgery. He now complaining from this shortening of breathing. He cannot take a breath. He like drowning. You will leave him like this?
No, I'm very sorry to hear this, and I apologize again for all of the suffer you have, and I hope the will for the best thing for your husband and for you. For this, the problem of the breeze, it's a temporary problem, and it's because the fluid in his tummy, it's got us a little pressure in his lungs, and that make him unable to breathe well. So I can offer to Mr. Mann to withdraw some of this fluid to get him a relief to take his breath well and get his lung expanded well and relieve of this pressure from him. And also there are a medication that can decrease of this fluid. And I'm sure he will get better, and his breath will improve. So can I summarize what we are talking about?
Yes.
Uh,
Yes.
Can you hear me?
Yes.
Okay. Mr. Jane, your husband is suffering from tummy fluid in his tummy. We get a sample from it lastly, and the sample showed us cancer cells, and we are now waiting for a CT scan know where is this cancer cells come from, and to get the stage of the disease, and plan the management of the and get the management, the full management plan of him. And also, of course, I will arrange you another appointment with Mr. Mann, and we will inform you until the new appointment is considered, and when the CT is fixed as well. So, do you have any question? Anything I missed?
No, thank you.
Thank you.
Okay, I will leave my number with the nurse. If you have any question or any problem, just tell her and she will contact me.
Okay, thank you.
Thank you.